I'm gonna go ahead and sanitize my hands and close the curtain for privacy. Hi, my name is Vanessa. I'm here to do a head-to-toe assessment on you. Can you tell me your name and date of birth, sir?
Ricardo Ruiz, 12/21/81.
All right, let me just check that against your wristband here. Okay. Do you have any allergies to medications?
No allergies.
Okay, and let me just check your chart here. Looks like the CNA did your vital signs already and everything was in the normal range. I'm going to go ahead and ask you a couple of questions. Can you tell me where we're at right now? What city is this?
Santa Clarita.
And what day is today?
Saturday.
What year is it?
2022.
And what brought you into the hospital today?
Not feeling well.
All right. So the patient is ANO times 4. He appears to be in a good mood, well groomed, appropriately dressed for his age. And when he spoke to me, he had clear speech. He was able to articulate. Doesn't look like he's wearing any hearing aids. Doesn't seem to be hard of hearing. No contact lenses or corrective lenses. Do you have any pain today, sir?
No.
Okay, 0 out of 10 pain. I'm going to go ahead and start my head-to-toe assessment now on you. Starting with your head, I'm just going to feel right here. Okay. Patient has normal hair distribution, no lumps, bumps, infestations, normal cephalic, and atraumatic. I'm going to go ahead and shine my pen light in your ears. So if you could turn a little bit towards that side for me. All right, perfect. And then does this hurt when I touch it?
No.
Okay, this ear. Okay, ears up here, no redness, no cerumen impaction, no drainage, no tenderness on palpation. Can you go ahead and plug one of your ears while I whisper a word and then tell me the word that you hear? Red.
Red.
Cover the other ear for me.
Blue.
Okay, whisper test shows that he has no hard of hearing, and cranial nerve 8 is intact. Okay, I'm gonna go ahead and look at your face. No facial droop. His face appears symmetrical. Head is midline, and his skin tone appears appropriate for his ethnicity. Let me check the chart again. It looks like a Snellen has already been done and the patient does not have any vision problems. So let's go ahead and look at your eyes. I'm going to shine a light in your eyes. Just look right here on my face and don't move your head, okay? Okay, and I'm going to look at the other eye. Okay. So when I observe his eyes, there is no redness or discharge. He does not have any contact lenses, corrective lenses. His sclera are white. After my test, cranial nerves 3, 4, and 6 are intact, and his pupils appear about 3 millimeters. Pupils are equal, round, and reactive to light and accommodation. One more thing for your eyes. Look at my pen, but don't move your head. Okay, yes. All right, everything looks good. Go ahead and tilt your head backwards a little bit for me. I'm going to go ahead and look in your nose. Okay, and then plug one nostril and blow out. Opposite side, please. All right, perfect. So patient's nose is intact, no drainage, and both nostrils are patent. Go ahead and open your mouth for me, please. I'm going to take a look inside your mouth. Okay, stick your tongue out and say ah.
Ah.
Okay. Have you had any changes to your sense of taste recently?
Nope.
Any cough?
Nope.
All right, can you do me a favor and cough?
Just cough.
Yeah, just cough. Okay, and then swallow. Okay, swallow again for me. Okay, perfect. Okay, I am going to touch your face Close your eyes for me. When you feel this is a soft sensation, and when you feel this side, this is sharp. So whenever I touch your face, tell me if you feel soft or sharp.
Soft.
Okay.
Point sharp.
Okay.
Soft. Point sharp.
Sharp. Okay. Perfect. So when I looked inside of his mouth, there was no cracks bleeding from his mouth or his gums. He did not have any dentures. Can you do another, I'm going to do another test. Can you smile? Puff up your cheeks. All right. And pucker your lips for me. Can you act surprised for me while closing your eyes? I'm sorry. Close your eyes and raise your eyebrows. All right, perfect. So, patient's mouth has no cracks, bleeding gums, dental caries, dentures or odors. His mucous membranes were moist. No pallor. He does not appear to have any goiters. His uvula rose and fell upon phonation and is midline. So cranial nerves 7, 9, and 10 are intact. When I palpated his neck, the trachea was midline, no deviations. There was no swollen lymph nodes, no JVD, no goiters, and the neck felt supple. Okay. And then I'm going to have you smell something. Close your eyes and tell me when you can smell it. Can you smell that? Okay. And then I'm just going to touch your skin. Okay. Skin is warm. So patient has no difficulty smelling. Cranial nerves 1 and 5 are intact. Okay. When I look at his skin, there's no macules or papules present. Skin color is appropriate for his ethnicity. There's no jaundice, no bruising, no swelling, cyanosis, scars, lacerations to his face or neck. His skin is warm and dry. I'm just going to pinch your clavicle right here. There is no skin tenting. All right, let's go ahead and check your arms. So I'm gonna have you lift your shoulders up against my hands while I press down. Perfect. And then can you wiggle your hands for me, your fingers? Okay, can you bend your arms? Sit up for me. I'm gonna have you move your arms in circles.
Without knocking the computer
Yeah.
over.
All right, perfect. Okay, and then can you squeeze my fingers with your hands? All right, perfect. I'm gonna feel your pulses. And then your brachial. Okay. And all right, go ahead. You can put your arms back for me. Let me just see one finger. All right. Okay. So he has full range of motion. Both upper extremities are symmetrical. He does not have any stiffness or swelling of the joints, and his nail beds were pink. Capillary refill was less than 3 seconds. There's no clubbing on his fingernails. And his all pulses, radial, brachial, ulnar were brisk, 2+, and equal on both sides. Okay, so what I'm gonna have you do now is sit on the edge of the bed right here. Can you turn your neck To the left? To the right? Okay, and then can you tuck your chin to your chest? Okay, all right, perfect. So, he has no, can you rotate your shoulders for me like this? All right, perfect. Okay, so bilateral upper extremities, shoulders, no stiffness or swelling, and no rotator cuff injuries, so cranial nerve 11 is intact. Okay, go ahead, you can lay back down for me. Okay, let's move on to the chest. So I have my stethoscope right here. I'm gonna go ahead and lift up your shirt. Okay, upon inspection, his thorax looks symmetrical. There's no scars, no bruises. He has equal chest rise and fall on inspiration and expiration, and there does not appear to be any accessory muscle use. When I'm gonna palpate, let me know if you feel any pain or discomfort on your chest here. Anything?
No pain. No discomfort.
Okay. Okay, so on palpation, no chest tenderness. I'm gonna go ahead and take a listen now. First to your heart. Okay, so S1 and S2 sounds were heard with no murmurs, bruits, or thrills, regular rate and rhythm. I'm going to go ahead and listen to your lung sounds this time. Every time you feel my stethoscope touch your chest, go ahead and take a breath for me, okay? Okay, so vesicular lung sounds in all anterior lung fields. Sir, do you use any tobacco products or any other substances that, like smoking?
No smoking.
Do you have any existing respiratory conditions?
Never.
Have you had a cough recently?
No cough recently.
Any mucus production?
No.
How about oxygen? You use that at home?
No supplemental.
Okay, so patient does not use any tobacco products or other substances, no existing respiratory conditions, no cough, or mucus production or use of O2. I'm going to go ahead and have you sit up for me, and I'm going to listen to the back of your lungs. Okay, go ahead and lay back for me. Okay, so when I observed the posterior, the spine was erect, no bruising, no scarring, no skin breakdown on the bony prominences, scapula or back of the head, the respirations appeared symmetrical, and he had vesicular lung sounds in all posterior lung fields. When I felt, he didn't report any tenderness on palpation. So I'm going to go ahead and look at your abdomen now. Upon inspection of his abdomen, there's no bulging, masses, distension, bruising, or scars. I'm going to take a listen to your abdomen. Okay, so he had normal active bowel sounds in all 4 quadrants. I'm gonna go ahead and percuss now, so I'm gonna put my fingers. Okay, so upon percussion, he had tympanic sounds throughout all 4 quadrants and a dull sound over the liver. I'm gonna go ahead and apply some pressure. Let me know if you feel any pain, okay? So we're doing light first. Medium. And then deep. No pain? Nothing?
No pain.
Okay, so upon palpation, there was no masses, no tenderness, no pain in all 4 quadrants. Okay, I'm going to ask you a couple of questions about your bathroom habits. Have you had when was your last bowel movement?
This morning.
Okay, and how did it appear? Was it normal or diarrhea, loose?
No diarrhea, normal.
Any nausea or vomiting?
Nope.
Any
No.
difficulty eating or swallowing lately?
Nope.
Okay, no constipation
Nope.
or blood in the stool?
No blood.
How about when you urinate? Is there any pain on urination?
Nope.
Any blood in the urine?
No, I don't think so.
And the color of your urine, is it yellow or dark?
Yellow.
Just yellow. Any foul odors? Any increase in your frequency or urinary hesitancy?
No, same.
Okay. Okay, so no nausea, vomiting, diarrhea. Last BM was normal and this morning. And no blood, foul odors, hesitancy, or dark color in the urine. Let's go ahead and take a look at your legs. I'm going to lower the blanket down and look at your legs. Okay, so could I have you bend your knees towards your chest for me? All right, perfect. And then you can straighten them again. Can you go ahead and push down on my hand like a gas pedal? Other foot. And then up against my hand. Up against my hand. Can you wiggle your toes for me? Okay, and then I'm going to pinch your toes. Can you tell me what foot I'm touching right now?
Right foot.
Okay, with your eyes closed. Okay, and then now?
Left foot.
Okay. And then let me feel your pulses. Can you lift up your toes? Your feet. I want to try to get you in frame. Okay. And then. Okay, you can lower your legs down. Now, with this foot, I'm going to push this. No pain? Okay. Okay. So on inspection, the legs have full range of motion, 5 out of 5 muscle strength, no stiffness or pain in the hips or joints. The skin color appears normal for his ethnicity. It was warm, dry, there was no bruising or tenderness, and normal hair distribution. No heat or swelling to the calves, no redness. There was no skin breakdown on any of the bony prominences, and his toenail beds were pink. Capillary refill was less than 3 seconds. He does not have any edema when I palpated. And then when I felt his pulses, his dorsalis pedis, posterior tibial, and popliteal pulses were 2+ equal bilaterally and brisk. Okay. I'm going to have you come sit on the edge of the seat again. And then I am going to test your reflexes. So I'm going to use this little hammer. and I'm going to hit against your knee. Okay. This side. All right. Go ahead and flex your biceps. Okay, other arm. Okay. You can go ahead and lower your arms down. Okay, so relax your arm on your thigh. Both arms right here. Okay. Okay. You can go ahead and lay back down now. Okay, so his bicep, tricep, brachioradialis, and patellar reflexes are present. Do you have any issues walking?
No.
Do you use like canes, walkers, wheelchairs?
No.
Okay. Let's have you stand up for a moment then. And just stand right here on the edge of the bed. Okay, stand up slowly. Now I'm going to have you close your eyes. Okay, the Romberg was negative. Go ahead and walk to that wall and back for me so I can see. Okay. Okay, go ahead and have a seat. So upon ambulation, he has a steady gait. His arms were swinging side to side. He doesn't use any ambulatory devices. And the Romberg test was negative. So cranial nerve 8 is intact. Have you had any falls in the past? No. Okay. All right. So he is not a fall risk. All right. You can go ahead and sit back on the bed for me. Go ahead. Okay. So I'm going to ask you a couple of personal questions. Do you have any plans to hurt yourself?
No.
Any thoughts of suicide?
No.
Do you plan to hurt anybody else?
No.
Do you feel safe where you're currently living?
Yes.
Okay. Okay, that was the end of my assessment. I'm gonna go ahead and sanitize my hands. Is there anything before I go? Okay, I'm gonna lower the bed down, raise the rails, put the brakes on the bed, and make sure the call light is within the patient's reach, and then I will open the curtain. Okay, thank you. I'll come back later and check up on you again. Will you hit stop for me?